And this is why I wanted to kind of transition a little bit into talking about the good versus bad fats. I think this is something that is important for all of us to know to better to continuously improve our health as well as the health of our families and the health of our patients if you are a provider. We know that there are inflammatory fats that unfortunately consist of trans fats, partially hydrogenated oils, and trans fats are made when hydrogen is added to liquid vegetable oils in order to make them solid in room temperature. These fats lower our good cholesterol, HDL, and increase our bad cholesterol, leading to inflammation and higher risk of cardiovascular diseases. So even though saturated fat have bad rep, there are numerous benefits to such specific saturated fats. We obviously dive deeper in our clinical nutrition classes. But if you just remember one thing from this presentation about good versus bad fats, remember that higher intake of omega-6 along with lower intake of omega-3 basically shifts your physiological state to more pro-inflammatory and pro-thrombotic, with increase of vasospasm, vasoconstriction, and blood viscosity, and the development of diseases associated with those conditions, as it was reported in several studies. There are several studies reported that omega-3s, for example, inhibit the expression of several inflammatory cytokines, such as tumor necrosis factor alpha, interleukin-1, COX-2, and protect against cartilage degradation. This is great news for patients who have been struggling with chronic inflammation, chronic joint pain, or degenerative conditions. It also alters the cell membrane phospholipids, fatty acid composition, and balances the excess of omega-6 that we have in our Western diet, in today's diet. It also reduces the expression of inflammatory genes and activation of anti-inflammatory transcript factor NR1C3. Both omega-3s or 6 are essential for us for good health. Typically, the ratios between omega-3 and 6 should be between 1:2 to 1:4, no more than 1:4. Unfortunately, many Americans are consuming a ratio that is much higher than that, much higher than 1:20 omega-3 to omega-6. An increase in metabolism of omega-6 is associated with pro-inflammatory state. And we have tested in our practice multiple patients that had very high ratios, like 1:30, 1:36, very high ratios that could, of course, put them at higher risk of developing cardiovascular conditions and other inflammatory conditions. This is another particular study published in the Journal of American College of Nutrition that states that if you increase consumption of omega-6 and reduce consumption of omega-3, you increase the risk of chronic disease and inflammation. So where is omega-6 found? Linoleic acid is the precursor to omega-6. This is what our body takes and creates omega-6 from. It's found in grains, animal fat, sunflower, safflower, peanuts, and corn. Now, why would animal fat contain high amount of omega-6? Well, because any animal that is fed grains and consume grains on a regular basis, which is unfortunately those grains are what the food industry is mostly feeding animals. That means what the animal is eating, the high levels of omega-6 that the animal is consuming will basically transformed into the meat of the animal, and then we eat the animal, and then we consume very high amounts of omega-6. Of course, with animal products, there's other byproducts that we know of, but just to give you a few examples, roasted chicken thigh, just one piece, has about only 25 milligrams of omega-3 in comparison to the 4,433 milligrams of omega-6. That's about 177 times of omega-6 to omega-3. Another example is the General Mills Cheerios. I know that every time I go to the supermarket and I look at the breakfast cereal aisle, it's one of the larger aisles in the supermarket. And so you can see that this is just as an example of how low omega-3s are in comparison to close to 3,000 milligrams of omega-6. That's about 29 times omega-6 to omega-3s. Let's talk a little bit about omega-3. Omega-3 is mostly found in fish, in seafood, shellfish, algae, and so you can either consume it through food or you can get it through supplements. There's also vegetarian or vegan supplements of omega-3s that are coming from algae. But here's just a few examples how you can diversify your diet and get higher amounts of omega-3s. So cooked Brussels sprouts, for example, has 270 milligrams of omega-3 and only 123 milligrams of omega-6. So 1 cup of Brussels sprouts will have about 2.2 times omega-3 to omega-6. Another example is cooked Atlantic cod. Fish, that's one fillet, will have about 310 milligrams of omega-3 and just 11 milligrams of omega-6. So that's about 28 times the omega-3 to omega-6. And those are just a few examples. And interestingly, when we dive into the clinical application of nutritional medicine, we can see an interesting study in which this was randomized, double-blinded, 3-month study in which they took patients with chronic knee pain and stiffness of their joints, and they give one group 3.6 grams per day. That's much higher than most patients will typically take. And they've reported a significant improvement in the morning stiffness and joint tenderness with consumption of omega-3 supplements. These clinical studies are really important to understand the different mechanism and how we can combine different nutritional supplements, different dietary and lifestyle guidance in order to help those patients to improve the clinical outcome, better serve them, make sure that they keep improving their health and function. And so this is where the specific clinical protocols we have as part of our advanced nutritional medicine is helpful almost for any type of chronic condition. And so if you're interested in learning about the root cause of chronic diseases, gaining new skills, and offering comprehensive care to your patients, then I invite you to check out our advanced functional and nutritional medicine program. We focus on the clinical application, and the program is comprehensive, self-paced, and online, which means that you can study from anywhere. We also include a variety of specialty classes, treating autoimmune, women's health, men's health, chronic pain, metabolic, cardiovascular, genomics, talking about functional pediatrics. We got a variety of topics for pretty much almost any chronic condition out there to equip you with the knowledge and the tools to help your patients. I invite you to reach out to us to schedule a call with an admission advisor, and I appreciate you being here, watching this video, growing your skills, and offering comprehensive approach to your patient. I wish you the best of health, and I'll see you in the next class.